All right, I checked the orders, verified the orders from the physician, and made sure that they were correct. I'm right here in the med room, and I'm going to go ahead and sanitize my hands, badge in, and I'm going to go ahead and pull up my EMR that shows my, of course the air is going. I'm going to pull up my EMR that shows the patient's information. We're looking at CSON right now, and I'm going to verify that I'm on the right patient, and I'm needing morphine, and this is going to be an IV push medication. It's going to be 4 milligrams for 1 milliliter. And yeah, so I'm going to go ahead and gather my supplies. Let me go ahead and put my gloves on to get going. Get my gloves, like I said, put these on. Whoop. And I'm going to clean out my med box really well, so that it's nice and clean, ready for me to put all my supplies in. And I'm gonna put a nice clean paper towel in the bottom of it. All right, so what I'm gonna pull out to get started, and then I'm gonna get 2 saline flushes. I'm gonna get a 3 ml syringe. Gonna get a blunt fill needle right here, and a syringe cap. Gonna get quite a few alcohol swabs. Some of these I'm gonna be taking to my patient's room with me. And I'm gonna be pulling out my morphine. So I'm gonna press the button, and that's gonna show me where I need to pull out. Drawer number 2. And right here I have it. My morphine, I'm gonna check right here that it's the same one. Morphine injection and IV push. Gonna check the expiration, make sure it's still good. It is. Gonna check that it's the right dose. So 4 milligrams for 1 ml, perfect. And this is also going to check that it's the right, so it's every 4 hours, which is what it says in the EMR, and as needed for severe pain has to be from 7 to 10. Okay, alrighty, so I got all of that set up, but I'm going to go ahead and make sure that I'm still signed into my EMR. Okay, gonna go ahead and first thing, pop the top off of this and sanitize it really well for 15 seconds. Rinse or scrub, okay. And that's gonna be drying right there. I'm gonna go ahead and get this 3 ml syringe. And I'm gonna grab this blunt fill needle. There. Alrighty. Now I'm going to go ahead and pull back 1 ml worth of air so that we can inject that into our vial. Alright. Perfect. I'm going to inject right in the middle and push that air in. I'm going to invert the vial. All right. I'm going to push back. There's a little bit of air, so let's see if we can get that out. Looking pretty good. All righty. Now what I'm going to do is do a single hand recap right here. Click that back on, and I want to take this off and go ahead and get my sterile blue cap on there. Maybe these things are a little tough to open with gloves on. All right, I'm gonna set this down. I'm actually gonna grab a blue label right here, and I'm gonna label. Good thing I have my pen. All right. Good thing my friend has a pen. Okay, label this right here, so the morphine. All right. Let me get this put on my syringe. And something else that I'm going to do, so I'm gonna put this in my basket. Right now I still have some, but this is because I'm using it for school. But I would go ahead and grab another needle, and another syringe, and go ahead and draw up all of this medication that's remaining in this vial. And I would Vocera in. Vocera, can I get a coworker to come in here and witness me wasting the rest of this morphine?
Julia.
Hi, okay, I have the rest of this morphine right here. I'm just wanting you to come in and witness me waste it correctly, okay?
Okay.
All right. And go ahead and draw it all up. Waste it in the proper bucket. And then I would have it pulled up, and she would go ahead and co-sign in the EMAR. She'd co-sign that she witnessed me waste it correctly.
Looks good, Julia.
All right, and so then I would go ahead and take my empty vial and put it in my medication cart, because I'm going to be taking that with me to the patient's room. So I have my syringe, my vial, my 2 flushes. Like I said, I'm going to bring some extra alcohol swabs. I'm going to make sure I sign out of my EMAR. It's important to do. And I'm going to go ahead and get rid of the sharps in the sharps drawer down here. And get rid of all my trash.
Come in.
All right, hi Mrs. Cison, how are you doing today? Awesome, awesome. My name is Julia. I'm gonna be your student nurse. Coming in here real quick. I'm gonna grab a few supplies. Well, half my supplies is gonna be my hand hygiene and put on some gloves. And set my supplies down. Over here on this end. All right, Mrs. Cison, I'm coming in here today to do a couple of assessments on you. I heard you had an injury on your foot, so I'm gonna do a couple of assessments. I also have some medications that we're going to be administering for you today. And then after that, we're going to do a CVAD dressing change, okay? So this will all be about 30 to 40 minutes that I'm in here with you, all right? But we're going to try and make it as smooth as possible. All righty, Mrs. Cison. First things first, can I go ahead and grab your name and date of birth? And any allergies that you might have? Okay, thank you. I'm going to go ahead and check your wrist bracelet as well and scan that. Thank you. It looks like you said what matches. And can I come over here to the computer where I'm logged into your EMAR and see that it says patient account verified. While I'm at it, Mrs. Cison, do you have any allergies we need to know about? Any in general? Any allergies to medications? Awesome. No, an allergy to penicillin? Perfect. That's exactly what it shows over here on the EMAR, so we're good to go. Awesome. Done scanning you. All right. I'm gonna go ahead and start raising this bed up so I can reach you better, okay, Mrs. Cison? And while I'm doing that, so what happened? What did you say happened? You fell off the ladder? And I'm gonna ask you a few questions about that. So when you fell, did you lose consciousness or get dizzy or anything like that before falling? No, you say you just slipped and fell. Then nothing happening. You didn't feel dizzy or lightheaded. Well, at least there's that. I'm sorry to hear about that. I'm going to go ahead and lower this right over here. Alrighty. So on a scale from 0 to 10, 0 to pain, 0 to 10, 0 being no pain at all and 10 being the worst pain imaginable, what would you rate your pain right about now? Rate it out of 9, you're not feeling too hot? Oh, I'm sorry to hear that. Well, like I said, we have some medication, so I'm hoping to be able to help you out, okay? And in regard to your foot, it's going to be your left foot over here that was injured, okay? I'm going to be checking it out as well. In regard to your foot, what would you rate that pain as, Mrs. Cison? You would say that one is a 10? Okay, good to know. And what kind of pain is it that you're experiencing in your foot over here? Is it sharp, dull, achy? All right. And when did that pain start? It started right after you fell? Okay. Well, that makes sense, of course. Okay, I'm going to come over here and pull back this sheet so I can check it out, okay? Alrighty, I want to be able to look at both of your feet and legs. Alright. And you told me what kind of pain that was over here. Alrighty, I'm going to go ahead and feel around a little bit and check out both legs, sets of legs, see how they're doing. Alright, and I'm noticing right here that on this left foot that you got injured, that there's a little bit of some bruising, okay? Some bruising, purple and blue. Alrighty, in comparison to your other foot, that's normal skin tone. Alright, and are you still able to move your foot, Mrs. Cison? Are you still able to have function in it? Yes, you can move it around, it just hurts too? Okay, well, I'm glad that you can still move it around, that's awesome. Have you been experiencing any numbness or tingling in your foot? No? Okay, that's awesome as well. I also want to go ahead and feel for your pedal pulse, okay? So I'm going to come right over here, feeling for both of them. And awesome, I'm feeling it on both sides, so that's great that we can feel it in this foot that's been injured. That's a good sign, Mrs. Cison. So I'm feeling it 2+, and it's equal bilaterally, which is awesome. I also want to go ahead and feel this foot right here.
I'm also feeling for coolness in your feet right now, and they're actually pretty hot, which makes sense considering your injury.
As well as what I noticed is swelling over here in your foot.
I also felt for cap refill, and it refilled under 2 seconds, which is awesome.
I'm going to pull this sheet back down. Cover those feet back up for the time being. And I'm going to go ahead and take these gloves off. Some more hand hygiene. Alrighty, Mrs. Cison. I want to also take some vital signs on you, okay? Make sure you're doing alright. So I'm going to clean my stethoscope off with some alcohol swab. Clean it off really well. And let it dry. First thing I want to be doing, is it okay if I take a blood pressure on this arm over here? Awesome. Real quick, I'm just going to grab that blood pressure. Alright. Looks to be like it was 144/80, which is a little elevated, but it makes sense considering that you're in a lot of pain right now. Alrighty, besides that, Mrs. Cison, I'm going to go ahead and get your O2 sat. Alright, looking pretty good actually, 93%, so that's awesome. I'm going to be checking your pulse right now, okay, Mrs. Cison? And I'm also, while I'm doing this, I'm looking at the clock, and I'm actually going to also be, while I'm doing this, counting your respirations, which you don't know, but y'all know. Counting your respirations, and this is very important because I'm going to be wanting to administer or give you morphine in a bit. Okay. Alright. Heart rate is 80. Respiration's 18, which is awesome. That's a good sign. Looking good. Alrighty, Mrs. Cison, and you already told me about your pain. It's a 9 and then a 10 in your foot, so we want to try and get that down. Alright. Alright, Mrs. Cison, got all those assessments done. I'm going to come over here to my EMR and type in what all I did and type in any description of that injury, that it was bruised, a little swelling, hot to the touch, but there was still movement, and no numbness or tingling, all that good stuff. Document. I'm going to save that documentation, and we can get started with your med admin. Alrighty, Mrs. Cison, so we're going to be administering giving you some morphine because of that pain that you've been having, okay? You just now told me that your pain was a 9, so we really want to get that down for you so you can feel a little more comfortable. I also just finished taking your respiration rate, and that was 18, and so that's good to go. And alrighty, so I'm going to go ahead and sanitize, do some hand hygiene before I get started. Gotta sanitize to get my hands nice and clean. And don some gloves right here. Alrighty, don some new gloves. And Mrs. Cison, can I get your name and date of birth and any allergies you might have? Any allergies at all in general, or any allergies to medication? Super important that we know all that good stuff. Alright, Cison, got you. Alright, perfect. And you said you have an allergy to penicillin? Okay, well I'm going to go ahead and scan into my I'm going to pull up your EMR. It's pulled up right here. And I'm going to grab my scanner. I'm going to connect it. Let's see that wristband. Perfect. And go ahead and scan. I look and see. It says exactly what you told me. And that looks good. I'm going to come over here into my account. It says patient account verified. And it also says on here that penicillin is the only allergy you have. That's awesome because we're giving you morphine today. So you should be good to go on that. Alrighty. And before, like I said, I'm gonna go ahead and check out this file. Today I'm giving you morphine, like I keep telling you. This is gonna be an IV push medication, okay? And it's gonna be 4 milligrams. This is the dosage that we're gonna be giving you. And this can be taken every 4 hours as needed for your pain, okay? So right now it's about 4:40 or so. I'll write up the time on the board so that you know when you can get it next, okay, Mrs. Cison? And I'm also checking the expiration once again to make sure that it's good to go. That what I pulled out in the med room is viable medication for you, all right? I'm gonna go ahead and scan this medication, all right? Scanned it right here. All right, Mrs. Cison, and we have a few more things before I go ahead and administer that medication. I want to check out your CVET site, if you don't mind. Just want to palpate around this area, make sure, has there been any tenderness or any irritation that you're feeling? Is this feeling okay right here, what I'm doing? Nothing's bothering you? That's awesome. We want to make sure that it stays nice and clean and that we can use it for your medication because this is really going to help you out. Awesome. All right. I'm gonna get my supplies ready over here. You've been doing okay today? All right, awesome. I'm glad to hear that. Minus your pain, of course. All right, so I have my morphine. I'm gonna go ahead and verify once again. I'm gonna look at the amount that I have and make sure it's 1 milliliter, which is 4 milligrams. And I'm gonna look again, check it out, make sure there's no air. It still all looks good. So we're gonna put this right here. Have a swab cap right here. We have our flushes that we're going to be using, and we have some alcohol swabs as well for you. All right. And I actually want to open these flush syringes before I even get started. That way they're ready to go. Gonna open them up and I'm gonna purge them. Get the air out of there. Just a double check. And we'll check once again in a second as well. Okay. So I'm gonna come over here. I'm gonna be using this proximal lumen right here. Oh, that'll be helpful to get this bed rail down. Okay, I'm gonna get this bed rail down, and I actually, because I touched the bed rail, I want to change my gloves out again. This proximal lumen. Gonna get my alcohol prep pad opened up. Have my flush ready. Swab cap off. I'm gonna make sure not to put it on the bed. Any trash, I'll set it over here for now. All right. So I'm gonna scrub this really good for 15 seconds. Scrub it all around. All right, and 15 right there. Whoop. Sorry, Mrs. Cison. Let me grab that from you. All right. And this is gonna make sure we'll let that dry. Yes, we're gonna unclip or unclamp the lumen right here. All right, it's open. And then I'm gonna open up this syringe right here. Put the lid over there. Once again, make sure there's no air in here. Okay. Connect this up right here. The first thing that I want to do is aspirate for some blood return, which is what we want to see. So I'm going to aspirate. All right. And okay, aspirated, perfect. We saw that blood return, that's awesome. Now I'm gonna go ahead and flush this line right here. We're gonna flush it pretty fast because we want that movement right here. And then we're gonna do push pause method. Push pause. And there's a little bit of an air bubble, so I'm gonna stop before we get to that point. But it's flush, all right. I got that flushed right there for you. I'm gonna disconnect this and put it over here. Alrighty. And what we have next to go in is gonna be your morphine, which is the good stuff, right, Mrs. Cison? But first, once again, I'm gonna clean this. Clean it nice and vigorously for 15 seconds. Get it all around nice and clean. And what I need to let you know about this morphine is it's gonna make you feel maybe a little sedated. And possible side effects might be some drowsiness or lightheadedness, okay? So it's important to be aware of that and let us know if you start to feel any of that. What's also really important is if you feel like you need to get up, here, let me put this back, sorry. If you feel like you need to get up to use the bathroom or anything like that, but you don't feel comfortable going by yourself, it's really important that you call us with the call light and let us know, okay? Because I don't want you falling. I don't think you want that for yourself either, okay? Once again, I really want to check and make sure. One last final check. 1 ml, 4 milligrams, perfect. This is going to be going in at a pretty slow rate, so we're going to be sitting here for a while, but this is ultimately for the better good, Mrs. Cecil, because if I put this in real fast, it's not going to feel good, trust me. All right, so this is going to be going in over the course of 5 minutes. So you and I will sit here together and hang out for at least 5 more minutes, if not longer, okay, Mrs. Cecil? All right, so I'm going to be watching the clock right here and making sure that I'm going at that rate. So here we go. So in 2.5 minutes, I should be to the 1/2 marker line and so forth. So we'll just go ahead and start going super slow. But like I said, this is for your benefit, trust me, because if I put this in fast, it would not feel pleasant. That 2.5 minutes is up. So we are about the halfway point, Mrs. Eason. And all right, and we're gonna go ahead and continue at this rate for the rest of the medication administration. So the rest of it would be administered at that rate. Okay, perfect. All right, I'm gonna disconnect this right here. Now what we're gonna do is follow that up with another flush, because we wanna make sure that all of that medication was administered to you. So once again, cleaning it off, because you never know, Mrs. Cecil. We want to just be triply clean. Okay, all right, connect it. And this one, we're going to start out giving for the first 2 ml of it, we're going to do it over the course of 2 minutes. We have to go slow on this part too, okay? Because there's still some medication in there, so we want to make sure that the rest of that medication is administered slowly as well. So I'm going to be watching the clock for these first 2 minutes of this as well. This is 2 minutes are up, and we are at the 8 mil marker point. Perfect. All right, the rest of this I can push pretty fast, so we can get this over with, huh? So push, pause, push, pause. Awesome. And I'm going to leave about 1 mil or so in the syringe. We want to make sure not give all of that. So 1 mil is left. Perfect. All right. And the last thing I'm going to do right here, you still feeling okay? Awesome. I'm going to make sure I'm put a new swab cap on the end of this. Keep that covered. All right, there we go. And I'm going to go ahead and clamp the line as well. All righty, Mrs. Cecil. All righty, I'm going to lift this rail back up. Make sure I click that back into place. I'm going to get all my trash and whatnot. All these syringes will be going in the sharps. Gonna save all my medications right here. I document that I administered the morphine at the time that I administered it at, around 4:40 p.m. or 16:40 p.m. 6:40 p.m. Okay, gonna document the time that I administered it and the amount that I administered, all that good stuff. Document, save, and sign out on that. All right, Mrs. Cecil, we're gonna go ahead and do your dressing change. Okay, you're on your CVAD. I know it's looking okay, which is awesome, but it still has to be changed every so often. So we're gonna go ahead and do that right now, okay? And I went ahead and put up a sign on the door to make sure people know we're about to do a sterile procedure. Before we get started, do you need to go to the bathroom or anything? You're good? Awesome, all right. It might take a minute, so I want you to be comfortable. Perfect. Let me go ahead and get some supplies going so I can clean off that table and everything, and we'll get started, okay? All right. I'm gonna go ahead and grab a wipe to wipe this table off really well. We want this to be nice and clean so we can make our sterile field on it. All right, get it nice and clean, leave it wet for the right amount of time, and then make sure it's completely dry before we start using it. Okay, you feeling okay over there, Mrs. Cson? Perfect, gonna toss these things real quick. Do a little bit more hand hygiene. And I'm gonna come over here and pull your gown down a bit so I can check out that dressing. All right, is it feeling okay? Any tenderness? Anything like that? Okay. All right, give me one second. I'm gonna be checking it out in a second. Sorry, I'm moving this pillow, by the way, so that we get as many things out of the way as possible. Okay, Mrs. Cson? So I moved it over there. Gonna move your hair back. All right. And we will get started here shortly. Okay. And if you don't mind, I'm gonna leave this right here on you, okay, Mrs. Cson? This is gonna be, I'm gonna use it for any trash that I have during the procedure, okay? Let that package start to get it ready. All right, I'm gonna go ahead and open this antiseptic and use it to clean my hands before we start putting these gloves on. Okay, I'm gonna put this over here in the trash. Right here. Gotta be careful about our 1-inch border. Alright. First thing I want to do is come right back behind it and pick up this first one and step away. I always start out trying to put it on the wrong way. And twist around. Okay. Here we go, right here. Perfect. Put that first glove on. I'm going to come back over here. Hold the paper down with this hand. And then I'm going to reach in. Move it further into the center of my sterile field. And go ahead and get my fingers in that cuff. And step away. And I'm going to help myself out here. I'm going to do my hitchhiker thumb. And voila, we got our sterile gloves on. Awesome. Alrighty. Checking out your dressing over here, Mrs. Cson, and it's looking like I'm going to go ahead and palpate around, okay? Just to check it out. Any tenderness or anything? Awesome. Alrighty. Well, I'm going to go ahead and start out taking this off. I have this alcohol swab stick if we need it, but it's seeming like it's going to come off pretty easy, okay? Yeah, it's looking like it. So I'm just going to be wiggling a little around to get it loosened up and peeling up toward the side. So just like this. What I'm actually going to do right now is I'm going to use this left hand to hold down these lumens. But after I touch the lumens, I'm not going to use this hand to do anything else. But I need to hold those down so that I can get this peeled off here. Okay. All right, got it off. Phew. All right, what I'm gonna do is take this glove off and put it in this hand and take these off. Phew. How many times will I say phew, huh? That's a real question here, Mrs. Hixon. Okay, I'm gonna do some hand hygiene once again. Some more hand sanitizer. Are you still doing okay over there? Awesome. And I'm gonna go ahead and get these other supplies out right here. My other set of sterile gloves. All right, opening this up. And move it over just like that. Move it around where I want it. Perfect. Just like this. All right, I want to give myself a little bit of space right there. Okay, awesome. I'm gonna come back over here and put my second pair of sterile gloves on. Gonna get this other antiseptic. Rinse. All right, this is always a good time, isn't it, Mrs. Hassan? Tell me about it. Okay. Very carefully open this up. And quite a bit of it is hanging off the table, so we're gonna just make sure not to touch any of that once we put these gloves on. Okay. Move that a little bit further. Okay, right there. All right, gonna stand right behind and pluck this glove up and step away. And right here we go. First glove on. Alrighty. Coming back over here. Gotta move it to the center and get my fingers under that cuff. Make room for my other hand. Hitchhiker thumb to get it in. Alright, perfect. Sterile gloves are on. Alrighty, Mrs. Cison, I'm gonna go ahead and clean this site. I wanna make sure before I do, you're not allergic to chlorhexidine by any chance? Awesome, alright, perfect. Gonna not touch the edges of my sterile field anymore because I got my sterile gloves, but I can touch the plastic. So I'm gonna touch the plastic and I'm gonna get this chlorhexidine. Okay, and I'm gonna scrub at the insertion site for 30 seconds. Nice and vigorously. All right, and then one swoop down the lumen and we're done, all right? Gonna go ahead and drop that right there. All right, I'm gonna go ahead and take this new dressing out. And gonna come over here. Peel it off. But I want to make sure of is that that insertion site is right in the middle, right here. And I'm gonna press down and seal up around the edges. All right, perfect. And now that we got that done, or the sterile part of our procedure is done. Awesome. Initial right here. And I'm gonna go ahead and put this on your dressing so that people know when the last time we changed it was. Right here for you, Mrs. Cison. Awesome. Gonna go ahead and get all these gloves off and clean up my supplies that I have. Awesome, here, go on. I'm gonna go ahead and put your gown back up and get that mask off of you. Awesome, so you can be more comfortable. I'm gonna go ahead and put this pillow back too. All right, that feel okay right there? Now you're comfortable in this position that you're in? Awesome. Okay, Mrs. Cison. I'm going to go ahead and bring your rail back up. And let's get up. Perfect. And lower you back down. Alright, and this bed is in the locked position over here. Alright, you said you're feeling comfortable right here. And now that we finished the procedure, do you need to use the bathroom at all? Okay, you're doing well still? That's awesome. Did you, on a scale from 0 to 10, I'm going to go ahead and ask you again. 0 to 10, 0 being no pain, 10 being the worst pain possible. How is your pain doing right about now? It's come down to about a 6. Oh my gosh, that's incredible. All right. Do you want me to move anything closer to you, to the bedside? Any possessions? No, you're good. You don't want to talk to anybody right now with your cell phone? Awesome. Okay, the last thing I do before I walk out, I'm going to go ahead and come over here and document that I did the CVAD dressing change. Then I document the date and all that stuff and save. And I'm going to badge out from your room. But if you need anything, your call light is right here in your hand. You can just press the red button if you ever need to call me for anything. Awesome. I'll be back around. Thank you so much, Mrs. Cison.